Hi, this is Dr. A with your medical terminology video on the word parts of the female reproductive system. So let's start with the combining forms. Abdominal is abdomen, amnio is amnion, cervico is neck or cervix, which is the neck of the uterus, but it's also neck, like your neck here. Chorio is chorion, colpo is vagina, coldo is cul-de-sac, cysto is urinary bladder, dilato is to widen, embryo is embryo, and episio is vulva. Estro is female, feto is fetus, gyneco is female, hymeno is hymen, hystero is uterus, lacto is milk, laparo is abdomen, mammo is breast, and so is masto. Meno is menses or menstruation, metro is uterus, nato is birth, oo is egg, but can also be oophoro, that's ovary, and ovo or ovi, which is egg or ovum. So ovary, oophoro, and ovario, egg, oo, or ovo, or ov. Peruno is sexual intercourse. Pelvo is pelvis, perineo is perineum, pio is pus, radico is root, salpingo is uterine or fallopian tube, sono is sound, utero is uterus, vagino is vagina, and vulvo is vulva. So let's look at some suffixes. Arche is beginning, and so we saw that in the word menarche, the beginning of the periods. Sciasis is a state of pregnancy. Emesis is vomiting. Genesis is produces. Gravida is a pregnant woman. Para means to bear, an offspring. Partum is childbirth. Salpinx is uterine tube. Totia is labor and childbirth. A few prefixes. Ante is before or in front of. Contra is against. Endo is inner or within. Multi is many. Neo is new. Nulli is none. Peri is around. Post is after. And primi is first. A few anatomical terms. So amniotic is pertaining to the amnion. Cervical to the cervix. Chorionic to the chorion. Embryonic to the embryo, endometrial pertaining to the inner lining of the uterus, fetal is pertaining to the fetus, and fibrous to having fibers. Lactic is pertaining to milk, mammary is pertaining to a breast, ovarian to an ovary, perineal to the perineum, uterine to the uterus, vaginal to the vagina, vulvar to the vulva. A few pregnancy terms now. We have antepartum, or antepartum is a period before birth, so a period of time before birth. Colostrum is a thin fluid that is first secreted by the breast right after delivery, and it contains a lot of antibodies to protect the baby. Fraternal twins, they develop from two different ova that were fertilized by two different sperm. Fraternal twins can be boy-boy, girl-girl, or boy-girl, and even though they're related, they may not look identical. Identical twins, however, develop from the splitting of a single fertilized egg, and they will look identical, hence the name identical twins. And they will be girl-girl or boy-boy, but never boy-girl. Meconium is a first bowel movement of the newborn. Multigravida is a woman that has been pregnant 2 or more times. Multipara is a woman who has given birth to a live infant 2 or more times. A neonate is a term for a newborn baby. Nulligravida is a woman who has not been pregnant, and nullipara is a woman who has not given birth to a live infant. Postpartum is a period of time just after birth. Primigravida, G1 or Grav1, is a woman who is pregnant for the first time, and primipara, P1 or para1, is a woman who has given birth to a live infant once. All right, so that wraps up all of our words for the female reproductive system.